Hi, good morning, good afternoon, good evening. Today I'm going to teach you about the tractions in orthopedics. Alright, as you all know, the traction is very basic applications in orthopedics, everyday life. Alright, this is the outline of the today topics. It's the aims and objectives for you today, the topics, tractions in orthopedics. Later, I will tell you detail of the outline of the procedure. At the end of the session, you will meet the learning outcomes, and then I will open the floor for the questions and answer. Alright, these are the outline of today. Aims and objectives for you today, traction, to observe the procedure in the orthopedic ward. Next, to understand the principle of tractions, how to apply the traction, what is the definitions of the traction. Last, to apply knowledge, what is the indications for the traction, what are the contraindications for traction, what are the complications of the tractions, how to solve the complications, how to manage the complications. Alright, this is the aims and objectives for you today. Alright, here we go. Outline of the procedure, how to apply the traction. Yes, of course, in orthopedics, injured patients, injured limb, fracture patients, fracture limbs, to apply the tractions in order to relieve the pain, in order to get the immobilizations, in order to relieve the pain, to stabilize the limb, to reduce the swelling. So these are the benefits you can get from the tractions. Yeah, we will go a little further. Indications for traction. Now let's talk about the indication for skin tractions. So we can manage the temporary management of the femoral neck fracture and also the trochanter fracture in elderly before we go operations. So to relieve the pain, to stabilize the limb, to reduce the swelling. So these are the indications for skin tractions. Another indication for tractions, there will be a post reductions of the dislocations. So to maintain the alignment, to reduce the pain, to immobilize, to stabilize the limb. So this is another indication for skin traction. So here you should know about the contraindications for skin traction. If the skin is not favorable conditions to apply the plaster, so this is not good time to apply the skin tractions. Or there's an open wound where the plaster apply. So this is another contraindication for skin tractions. So if you think the patient is having the vascular compromise, arterial insufficiency, so we cannot apply the skin tractions. Alright, so these are the contraindications for the skin traction. So here we need to know about the complications of the skin tractions. Shall we continue the complications of the skin tractions and skeletal tractions? Of course, you apply the skin tractions, so you should look for the complications next day during the ward round. Alright, there may be complications of the skin traction. There are allergic reaction to the plaster adhesive. There may be excoriation of the skin. There may be pressure sores if you're not enough cover, enough padding to the bony prominence, especially the lateral malleolus. Or if you tie the bandage So that can lead to the common perineal nerve injuries later. Alright, so you should think of the skeletal tractions complications. Of course, skeletal tractions, so this is an invasive procedure. So mostly we apply over the proximal tibia. So if you're not following the aseptic techniques or carelessly, that will lead to the pin tract infection, can lead to the osteomyelitis. Or if you apply the weight very heavy, there may be a ligament injury. Alright, or if you put the heavy weight in the pediatric, there may be epiphyseal growth plate separations. Alright, so please take care of the complications of the skeletal tractions. After you apply, you always look for the care, after care. So nursing care also important. So you should check the distal circulations every 4 hourly. And also next day, you maintain the tractions and also to check the skin condition, whether skin is breakdown or not. Not only locally, you should check patient generally about his nutrition, about his hydrations. Okay. Again, you should look for the foot draw, the signs of pin site infection. Again, to support morally or psychosocial support needed to the patients. Alright? Alright, so I believe you meet with learning outcomes for you today. Tractions. What is skin tractions? What is skeletal tractions? What are the indications for traction? What are the contraindications for tractions? What are the complications related to the procedure? How to manage the complications? So these are the learning outcomes for you today. Is there any questions or is there anything not clear? You are free to ask me. Now I open the floor for the questions and answer. Later I will end up with my references and also the link for the slides. Alright, and thank you very much.